Hello, my name is Daniel Stillwell. I'm the e-newsletter editor for IFTA, and today we have with us Dr. Karl Tomm. He is the director and founder of the Calgary Family Therapy Centre, and he also has a position as a professor of psychiatry at the University of Calgary. Thank you so much, Dr. Tomm, for joining us today.
Oh, you're welcome. Good to be here.
My first question is one that I like to ask all of our people because we have viewers and readers from all over the world, and systemic psychotherapy or family therapy looks different in different places. So I guess I want to start off with your identity. What kind of clinical practitioner do you identify as, and what does that look like in context?
Well, I see myself as a systemic therapist, and I'm very interested in relationship systems. And I work from the premise that the human mind is a social phenomenon, first and foremost, and secondarily psychological. And so if I'm interested in mental phenomena, I want to then work in the interpersonal space to try to optimize healing and wellness. So that's how I position myself.
Wonderful, wonderful. This year is the 50th anniversary of the Calgary Family Therapy Centre opening. Can you tell us about the anniversary celebration, and what are the sort of lessons or big ideas that you've gleaned over the years being at the helm?
Well, first of all, the 50th anniversary celebration, it's going to be in August, and we've got 5 days planned, 2 days of workshops, they're pre-conference workshops. We have 20 workshops set up, and then we have 2 days of conference presentations with plenaries and so forth, and we have speakers from all over the world, 18 plenary speakers. And then the 5th day is sort of a wrap-up and discussion about how we can document what came out of the conference.
Wonderful. Is that something that people can still sign up for or attend if they have the opportunity to come to Calgary?
Oh, absolutely. In fact, we have a section set aside for brief papers for people who would like to present. And we have lots of space still. We just started advertising. So if anyone's interested in submitting a paper and making a presentation, they're welcome to do so. We might have multiple rooms available going at the same time in parallel if we have a lot of submissions. So by all means, if anybody would like to join us, they're most welcome.
Wonderful, wonderful. Then I will definitely make sure that in the e-newsletter that is made available and we can connect them with you. Being as the founder and the director of the center for so many years, what themes or what processes have you seen change over the years?
Well, actually, we've gone through several changes over the years in terms of our conceptual understanding of families and family therapy and so forth. But the single biggest change that occurred was during the 70s, late 70s, after my first sabbatical, when we moved into the Milan approach. And we adopted the second order perspective of looking at ourselves, looking at the systems. So we were part of the observing system in the therapy process. And that to me was a huge shift, because prior to that, I was more grounded in empirical ways of thinking and practicing based on my past history of training in medicine, so forth. But I then abandoned that sort of objective view to more of a social constructionist perspective. And eventually I moved on to Maturana's bring forthist perspective.
Okay, so not only have you changed and your thinking kind of evolved or adapted to new paradigms, but it sounds like the center as a whole has reflected that.
Yes, yes. Yeah, no, I've been recruiting like-minded colleagues to join with me in this journey, and it's been so enriching for me to have that opportunity to collaborate and so forth. And we do lots of training as well as offering services and a bit of research as well. Most of the research that's come out of our program has been kind of conceptual research, developing models and frameworks and so forth. But it's been a very enriching and enjoyable process. Been very lucky actually to have contact with a lot of the pioneers in the field of family therapy, like Gregory Bates and
Mm,
Joanna and the Land team. Unfortunately, most of them have passed away now, but I was lucky to have worked with them.
absolutely. Then I think that dovetails very nicely into the next question, which is, what do you want people who are in their first decade of being a clinician or a professor or a researcher, what do you think that they can take from your broad experience of theory over the years?
Well, if they could sort of get a handle on Maturana's theory of knowledge in terms of how we as human beings come to know what we know, and realize that you can't put ideas into another person's head.
Mm,
You can create conditions for them to learn, but instructive interaction from Maturana's point of view is impossible. And if people can adopt that stance, then that shifts the way in which they relate to clients and families, where they try to invite people to see possibilities. And if they're not able to step into those possibilities, they try to open space in other areas. And so the therapist needs to be willing and able to move around to open
mm.
space where people can go in their development.
And I suppose you can do that from a modernist or a postmodernist perspective, but you've found more meaning, I guess, in postmodern social constructionism more recently, correct?
Yeah, yes.
Another term that I've seen you use is the idea of bring forthism. That one I think is a little less clear in the field still. What do you mean by that term?
Well, that term was coined by Heinz von Forster, who is a friend of Umberto Maturana's. And actually, Heinz was Ludwig Wittgenstein's nephew.
Ah,
So it's a very interesting um, history and background. Um, Maturana himself didn't use the term bring forthism, but he was comfortable with Heinz and myself and others using the term bring forthism. But it has to do with the view that we as cognizing living systems interact with our medium and bring forth the distinctions that then organize us in our response to that situation, whatever it might be.
mhm,
And in Maturana's perspective, we need to recognize that we have to take full responsibility for the distinctions we draw. So, for instance, if you bring forth a distinction of some family member crying, that could be distinguished as whining or as weeping. And if you distinguish it as whining, you would set in and process a pattern of interaction which would be more negative in terms of trying to restrain the person from manipulating or whatever, as opposed to weeping. If you distinguish it as weeping, then you bring forth more compassion and so forth. So how we draw distinctions is so important in terms of how we then respond. And we have to take responsibility for the distinctions we draw, because that's part of our cognitive activity in our living.
that also sounds very, I mean, the field of cultural competence has changed to cultural humility more readily these days. And that sounds like a very culturally humble approach to, like you said, not project or prescribe meaning necessarily, but engaging it in a participatory way.
Yeah, like bring forthism is consistent with social constructionism in terms of the idea that it's through social interaction that constructs are created and generated. But bring forthism, I think, offers a fuller explanation, because it's grounded not just in culture and social relations, but also in biology. And so
Mm,
bring forthism offers an explanation for how we as social actors exist in the first place as biological systems, and are interacting in our niche or context, right? And so that's why I prefer to embrace bring forthism rather than social constructionism, because in my
mm,
view, social constructionism is basically grounded in groundlessness, whereas bring forthism is grounded in biology, where the viability of the living organism is required in order to be in social interaction. Like we need to have a
mm.
nervous system in order to interact with each other, And it needs to be plastic enough that we can change in the process of that interaction, right?
Yes, and I can hear the integration of theories from medical to mental to social, even as you described. So I think that that is certainly a meta lesson of a career that like yours, for so many young people, is to not get overly siloed and be able to find ways to connect with so many different paradigms, because the human condition is quite broad.
Yes, absolutely.
Well, thank you so much for spending some time with us and giving us an insight into your thinking and anticipating the celebration over the summer. Is there anything else that you would like the viewers to know about you, either personally or professionally, that might be interesting?
Well, maybe just that I've been a very lucky man. That I was, in the right place at the right time, able to interact with so many, stimulating colleagues and so forth. It was a very enjoyable journey.
Hmm. Wonderful, wonderful. Well, Dr. Tomm, thank you so much for spending some time with us today, and we will be excited to hear more about what the Calgary group is doing as the year unfolds.
Okay, thank you. Take care.